Hi everyone. Switch topics a little bit. Talking about the rise of healthcare startups. Actually, everyone today, this year, is talking about like the next years. There's the big rise of e-health startups. However, the e-health startups, the market overall is extremely slow, and a lot of business models have not been proven to be economically feasible. But still, there are business models out there in the health sector which work, and we're happy to have a discussion with one of our portfolio companies, Medbelle, and maybe you could have a short introduction about yourself.
Wonderful, thank you for having us. I'm Leander, co-founder and CEO at Medbelle. Background in business, but essentially also write code since a young age, so this is where the technology edge comes from. Both parents general practitioners here in Germany, and then I had my own knee injury about 8 years ago. And essentially that was the moment where we thought, well, this can be done much better. Definitely to improve like the patient experience of how things have happened, but also to just create more transparency about which doctor is actually good and how do we make medical results transparent. And lastly, just in the administration and essentially efficiency to keep healthcare as we have it essentially still available to us when we are old, because right now that wouldn't be the case. So that's what we set out to do back in 2016 and launched Medbelle as a company.
And we, as Mutschler Ventures, we are an investor with a family office background, actually one of the most active ones in Central Europe. Back then, like our investment thesis, and I just looked it up, is that we love that you're operating in UK, which is not a really functional market when it comes to healthcare. Everyone knows the stories about the NHS. It's actually quite insufficient. And we liked, besides the team, we liked that you really create true patient value. Maybe you can comment on this. What does it mean, true patient value, and where does stand Medbelle today? Where are you standing today?
Yeah, maybe one or two words about what Medbelle actually is to put this into context first. So I think essentially Medbelle is what we call the first digital hospital. You can picture that as kind of the natural evolution of traditional hospitals in a way where we basically go in and digitalize all of the care coordination and the administration, and only for the physical parts of your treatment. So you can come in for consultation, the diagnostics, the surgery, the aftercare. Essentially, we work with specialized physical facilities. And essentially, you can picture that as if you have a knee injury or your mom needs a hip replacement, they come to us, and essentially we guide them all the way with a personal patient care advisor from the beginning to basically recovery. And in the background, there's a network of surgeons and other clinicians that is supported by our technology called Medbelle OS, where we not only smoothen the pathway essentially for the patient, but also collect data about how good is that medical result, how much less pain does this patient actually have, and how much did it cost us to make this patient healthy again, which basically allows us to not only deliver a great experience for one individual, but also for essentially the whole healthcare system as a whole to make it more efficient.
Maybe just to comment on one thing, what does it mean to have a digital hospital? Because for me, it also took a while to understand it, to imagine it. It means that you digitalize everything what can be digitalized in the healthcare. Of course, the treatment itself needs to happen, but everything else, before and afterwards, you don't need a physical hospital, you just book. It's like an asset-light model. You just book a place. It could be in a hospital, it could be another space. You bring the patient at one moment, you bring the physician, the doctor, and that's it. All the administrative stuff, all the aftercare, all that is done digitally. A little bit like the Maximilian model. Maybe you can give us a little bit an understanding what are the challenges over the last 3 to 4 years?
I mean, I think we can put it into categories. I think everybody usually talks about regulatory first when it comes to digital health. And that is definitely a challenge, and we had to go through some points. But I think for me, trust is much bigger. And I think this is important for everybody else kind of going into this space in the future as well. We started with self-paid procedures, so where the patient pays out of pocket in the UK because they wait for 4 years in the public market after diagnostics to get surgery. The reason why we did that is because effectively these patients need help. You don't have to have a contract with a big insurer who needs to trust you as the 2 young guys who basically claimed to build a digital hospital in the beginning. And we started a company in 2016. Now we have actually signed one of the biggest private health insurers in the UK, but it took us 6 years to basically develop the traction to basically do more than 2,000 procedures, more than 10,000 consultations with patients, get to a level where you can now online look up that we're the best rated medical provider in the UK. But it took 6 years to basically get to that step where an insurer now says, well, now we can give you a try. And now you're at that point where you suddenly have, after 6 years, for the first time, true product market fit, and you're scaling. But I think it's a completely different timeline than you would find in many other industries. So trust, I think, is both with clinicians, with hospitals, with insurers, for sure, like a massive element that I think is very, very different to any other industry. Maybe a second one here is just the level of operational complexity. So when we started, we thought, well, okay, maybe we can build a fairly lightweight software that basically supports the whole process from the very beginning of the patient journey to the end. Turns out there was a lot of in-depth work to make the product work. There are so many differences of how different clinicians work with an individual patient, and you need to build all of that in. And while we're definitely not at full completion, I think we're now at a stage where you can say, well, this also provides defensibility. So there's no chance that somebody else can basically go the same route really quickly. So they're both usually upsides and downsides, both the trust and of the operational complexity, where it takes longer initially, but once you're in, you're in. But you just need to know how long you actually need to go for.
What is the role of your investors in this during this journey? So how do you explain this to your investors? Because some investors are used to stories like Flink and Gorillas, and after 3 years you have more than a unicorn. What's different in health?
Yeah, I think essentially we always position Medbelle as a potential solution to really fix our healthcare system in the long run. It's a long run play. It can be incredibly big. It is one of the few companies that has a multi-trillion-dollar potential, but it will take time. And I think that is something investors know in the space. And we are very grateful to have you guys and also lots of others essentially on board who have come in with that sort of expectation. I think for some people who are new in digital health, essentially it is something they learn along the way and you need to educate essentially. And I think I'm very grateful to also have very experienced healthcare investors in our board. And that helps a lot to basically set the right expectations. But I think over time, when the success comes, suddenly everybody's happy. So I think there are ups and downs that come to this, and I'm just very glad we have the right investors on board who basically brought us to where we are today.
Maybe you can give us an idea of the significance of the Bupa contract and like the market size, maybe also 1 or 2 numbers, number of cases, and get a bit of feeling.
Yeah, I mean, I think generally right now we are focusing on this sort of like patient who's waiting on the public system in the UK, cannot get surgery, which is like a basically 7 billion or so private healthcare market in the UK. For those, we are, as of today, probably the best option to get care. It will be cheaper, it will be better, it will be an amazing experience. I can just encourage you guys to check out the Trustpilot reviews, and essentially it will be also, from a medical results perspective, at least we track what is happening so we can optimize our results over time. For us, this was really possible only through a major contract with a large health insurer, which effectively also brings volume on the one side, but also let us basically work with any hospital in the UK or any private hospital in the UK. Before, we went to everyone individually. Basically, you have 1-year sales cycles for every single hospital on whose doors you knock, and then this allowed us to basically scale significantly quicker. And I think that was a game-changing moment for us that, of course, now allows us to grow very, very heavily. But again, it is only enabled because we build trust, we build results, we can actually show numbers of what happened to our patients.
So for us, it's an example where you have shown true patient value, and it took a while, and it took also quite some money, but you've shown really the product market fit as you described it. What are the next steps for you?
And I think, as I mentioned right now, I think we're now at this point where you can say we have product market fit for patients waiting on the NHS. So it's really a growth case for the next couple of months and years, essentially, to become the dominant player in all things self-pay in the UK. But we also know that what we do can actually save our healthcare system significant costs on an insurance side. So we will actually also run a pilot on that, probably after a B round, which we will raise summer next year, most likely. And that should be then a pretty nice case to actually build a case study in the UK and then go to the US, which is our kind of like next step after that.
Thank you, Leander. Thanks, everyone.
Max and Leander. Thank you, guys.